Hi, everyone. Welcome to our Quick Talk series, Quick Answers to Trending Topics. Today's important topic is on unsedated transnasal endoscopy. I am Allison Serco, Regional Director of Community Outreach with Hackensack Meridian Health and Hackensack Meridian Children's Health, and I will be your moderator. We're very grateful to have Dr. Eliana Shaw from Hackensack Meridian Children's Health speaking with us today. A little bit about her. Dr. Eliana Shaw received her medical degree from Albert Einstein College of Medicine. She completed her internship and residency in pediatrics at the Children's Hospital at Montefiore Albert Einstein College of Medicine. She went on to complete a fellowship in pediatric gastroenterology, hepatology, and nutrition at the Children's Hospital of Philadelphia. Dr. Shaw provides broad expertise in the care and management of children with gastrointestinal diseases. She fosters skills in many unique subspecialties within the field of pediatric GI diseases, including unsedated transnasal endoscopy using virtual reality goggles and providing individualized care to children with very early onset inflammatory bowel disease. And during her spare time, she enjoys spending time with her husband and 3 children, biking and reading. The information presented and discussed today is educational in nature and is not intended to be taken as a specific recommendation. If you have any personal questions or concerns, you should speak with your primary care physician. All right, so we will get started now. The first question for today is, what new technology is available at Hackensack Meridian Children's Health, Joseph M. Sanzari's Children's Hospital?
First, thank you for that introduction. And what is now available that's new and exciting, the first and only in New Jersey, is unsedated transnasal endoscopy. And then we also have standard upper endoscopy available.
What is a standard upper endoscopy?
Yeah, so I think kind of importantly, before we describe the new technology, it's important to say what is standard of care and readily available. So a standard upper endoscopy is used by pediatric and adult gastroenterologists to evaluate the upper GI tract. So it evaluates the esophagus or the food pipe, go into the stomach, and then the first part of the small intestine, the duodenum. And we use it to diagnose and monitor a whole bunch of different GI conditions. So you'll use it to evaluate patients with belly pain, nausea, vomiting, trouble swallowing. And it's used to diagnose as well as monitor celiac, Crohn's disease, H. pylori, eosinophilic esophagitis, amongst a whole bunch of other diseases and conditions. And this procedure is done while a patient is asleep. So an anesthesiologist would come, place an IV, and uses moderate to deep sedation, depending on the situation. Due to the anesthesia, there's a period of nothing to eat beforehand, typically for about 8 hours. And usually it requires about a day or so to get back to yourself. So there is a little bit of a recovery time, which leads to missed school and missed work.
All right, so now tell us, what is an unsedated transnasal endoscopy?
So I think the biggest difference is that this is done on an awake patient. So a patient, or in my situation as a pediatric gastroenterologist, the child is sitting in an upright position in a chair, totally awake, and I use an ultra thin endoscope, so much thinner than a standard scope. And we do use some topical anesthesia, so some lidocaine jelly that we insert into the nose and the mouth to numb the area to minimize pain. And then I insert the scope through their nose, go to the back of their throat, again, into the esophagus, the food pipe, into the stomach. And in some cases, I can go into the duodenum, but usually only the esophagus and the stomach.
All right, next question. What are the benefits of the unsedated transnasal endoscopy?
So the biggest benefit is no sedation or anesthesia. So you are totally awake. With that comes no IV, which is one of the scariest parts for a lot of the kids. There's no fasting period beforehand. So usually I'll have the kids eat a light breakfast and then nothing to eat for an hour or two, but no prolonged fasting. And In addition to the no sedation, it's a pretty big deal that there's, no major recovery time. Within 15 minutes, the lidocaine jelly in your nose and the back of your throat wears off. And you can go back to school, work, life, kids can go to soccer practice, basketball, whatever they want to do. And there's really no recovery time. Additionally, it is lower cost to a standard endoscopy, which is also good.
So wait, no sedation?
Yep. So as I mentioned, we do use some topical lidocaine, both in the nose as well as in the back of the throat. And the kids are totally awake. So there's always a parent, one or two parents present in the room. So sometimes parents will hold their child's hands. And instead of anesthesia, in most cases, we use virtual reality goggles. So the goggles, as you see in the picture, are placed on the child's head, and they are watching either Netflix, Amazon Prime, really whatever they want. And kids are like totally in the zone, distracted, watching their TV. I've also had patients who want to watch the procedures. You don't need to use the virtual reality goggles, but the VR goggles are an awesome form of distraction. We also do have child life present in the room to help also with distractions and alleviate, any stress that's going on during the procedure. We can provide you stress balls, squishy balls, other toys, and kind of just talk through the procedure. I always tell the kids, you have a breathing pipe and a swallowing pipe, and I'm going down the food pipe. I'm not in the breathing pipe, so you can talk, you can breathe, and kids talk to me during the procedure. I'll even have them, drink a sip of water during the procedure if it helps. But usually kids are totally watching their TV, completely distracted.
What are the risks of unsedated TNE?
So the risks are similar to standard endoscopy, but because it's a smaller scope with smaller biopsy forceps, the risks are a little bit lower than a standard endoscopy. There are some added risks since we're going in through the nose. You can have some nose pain and rarely nosebleeds, but those are pretty rare, and it's usually very well tolerated without any risks or side effects. And so I just thought this slide was kind of a nice summary of standard endoscopy or EGD esophagogastroduodenoscopy versus an unsedated TNE. So the biggest difference, again, no sedation. So in a standard endoscopy, there's an IV placed and sedation, whereas in a transnasal, there's not. The site of insertion is the mouth in a standard endoscopy versus the nose. And a pretty big deal is the nothing to eat beforehand period. So in a standard endoscopy, it's 8 hours, whereas in a transnasal endoscopy, it's 1 to 2 hours. And I encourage the kids to eat a little bit of breakfast. And I also, if they're feeling a little nervous, we'll have them drink a little bit. So it's not a big deal if they drink a few sips before the procedure.
What age and diagnosis are appropriate for unsedated TNE?
So in general, we use TNE in diseases that require kind of repeat esophageal assessment. So the most common disease that we use it in is eosinophilic esophagitis, which I know is a mouthful, or EOE, which I'll describe in a couple minutes. But we can use it really in any inflammation of the esophagus, so fungal esophagitis, really other esophagitis. We can use it in gastritis. It's kind of a quick way in an awake patient to look at the esophagus, take some biopsies. I've only used it once there's an established endoscopy, so it's not done as the first case, but in diseases that require repeat evaluation.
And I'm going to keep it short so I don't say it wrong, but can you tell us a little more about EOE?
Yeah, absolutely. So I kind of think of EOE as eczema of the esophagus. So just like in eczema, how the skin is really stiff, in EOE, which is a chronic disease, an inflammatory disease of the esophagus gets really stiff. So usually the esophagus is mobile and it moves and pushes food down. And in EOE, it's really stiff. So that can present kind of with trouble swallowing and feeling like food is getting stuck, can lead to nausea, vomiting. Sometimes in younger kids, though, they're not able to express that as well, and they'll just really avoid certain foods. So they won't eat foods that get stuck, such as steak, chicken. They'll also kind of over chew and chew and chew, slow eating, or dip everything in a sauce. So there's lots of compensatory behaviors that kids will develop. but it also can just present with poor growth, belly pain, really in a variety of ways. And there's a lot of ways to treat it, but importantly, you need frequent esophageal examination and biopsies to determine if a patient is in remission, because the symptoms don't always correlate with how bad the inflammation is. So sometimes kids are feeling better, but there's still a significant amount of inflammation. So these kids do end up getting repeat endoscopies.
So what population and diagnosis are appropriate for unsedated TNEs?
Yeah, so in terms of the diagnosis, as I mentioned, usually EOE, but really we can do it in any disease to establish the endoscopy. And, in terms of the population, I think it requires a comprehensive screening and kind of discussion amongst a patient, family, and provider. These rules are not hard and fast rules, but in general, typically kids who are 6 and older do better. I have to say, some of the younger kids I've done it on do really, really great with the Netflix, especially. Like they are completely distracted. But I say 6 and above, really, because as you grow, your nose grows, and if the nasal cavity is really small, it's a more difficult procedure, and the kid needs to be old enough and mature enough to kind of sit through. And then, other special considerations include if a child faints every time they have, they're standing for prolonged periods or they get any type of procedure, probably not the best candidate because again, this is awake, and we don't want them to faint on the chair. Certain nasal deformities do make it a little bit more technically challenging and a little bit more uncomfortable. So again, discussion with the patient and family. It's not necessarily a no, but just something to consider. Same with special needs and behavioral issues, depends on the extent. And if they're able to sit with the virtual reality goggles. And in terms of uncontrolled anxiety, I mean, there is a lot of anxiety and depression and different psychiatric diagnosis, and that does not exclude you from an unsedated TNE. I find a lot of kids with anxiety are much more anxious about the IV than they are about the actual procedure. So again, I just think it's a discussion that we need to have and kind of tease out like what is making you feel anxious about the procedure and see if they're a good candidate.
Great. So overall, why is this new technology important?
So I think in general, I mean, it's just a great alternative to monitor diseases of the esophagus without the risk of anesthesia. There's less complications. The recuperation time is really quick. You're back to school, back to your activities on the same day. Really, I have them once their, nose and mouth are kind of getting over the lidocaine jelly, they eat a popsicle and then they just go home. No limitations. So I think it's a really, really great option for kids who need repetitive esophageal monitoring.
Well, thank you so much, Dr. Shaw, for sharing this great information with us. It was very helpful and informative. And thank you all for taking the time to join us today. Please visit our website at hmh4u.org events to find out more information about any other upcoming programs, or you can also visit our Children's Health website to listen to this quick talk again and other quick talks. So thank you again and enjoy the rest of your day. And thanks for listening in.
Thank you.